With that, I would like to introduce our panel facilitator, Mary Jo Condon, the Senior Director of Partnerships and Projects at the St. Louis Area Business Health Coalition. She began her work in healthcare policy as a journalist, covering healthcare issues, and gained national acclaim for her weekly healthcare finance column in the St. Louis Post-Dispatch. Mary Jo left journalism in 2008 to join the Business Health Coalition, which focuses on providing physicians, patients, and purchasers better information on the quality and affordability of healthcare treatments and providers. Mary Jo. Yeah, when we open it for questions, I will be here around. Yeah.
We'll take you first. Well, I'd like to begin by introducing our panel. Dr. Johnetta Craig is a board-certified family medicine physician and the Chief Medical Officer for Family Care Health Centers. Family Care Health Centers is a nonprofit community health care provider with 2 clinics located in the city of St. Louis. These clinics serve uninsured and underserved residents. Dr. Craig is known for her commitment to improve equity in the healthcare system. Bill Hill is president and CEO of Visor Benefits, a multidisciplined insurance benefits agency which aims to support employees in designing personal health care plans. Bill has 20 years of experience in the employee benefits industry, working in consulting, self-funded group medical sales, worksite benefit plans, and advanced life and disability insurance sales. Thomas McAuliffe is the policy analyst at the Missouri Foundation for Health, where he is responsible for coordinating and communicating about MFH's work related to health policy research, evaluation, and analysis. Thomas is a sought-after speaker on the Affordable Health Care Act and its impact. He has presented on the law at conferences, lectures, town hall meetings, and community gatherings across Missouri. Tim Simpson is a principal in the St. Louis office of Mercer, a human resources consulting firm. He is the consulting leader for the health and benefits practice and also consults with clients on all aspects of employee benefit design, funding, and administration. Tim has more than 30 years of experience in employee benefits, having worked in both human resources consulting and in actuarial services for a large insurance company. So we're going to start today with each of you talking real briefly about your initial response to the Supreme Court decision and what you think it's going to mean for your daily work. Dr. Craig, you want to go first?
Go first? Okay. Good morning. First of all, I want to thank Ryan and the MFH for inviting me to participate in this panel. And I will say my initial response was one of a sigh of relief to a certain extent. Because at least having this hurdle cleared, it does give an opportunity for the ACA to have the possibility of implementation of all of its provisions. And what that means for safety net providers is huge. Assuming that the state of Missouri does go along with participating in the Medicaid expansion, it's going to make a huge impact on our bottom line. Unlike many providers, Medicaid is actually a good payer for us because right now, 40 to 50% of our patients have absolutely no financial payer, a third-party payer, for the care that they receive. We do get supplemental support from the federal government in the form of our 330 grant, which is a grant from the Public Health Service. So it does allow us to provide a sliding scale, but it does not cover all of our costs, obviously. So the decision by the Supreme Court does allow the act to move forward to start to work out the intricate details of the actual implementation. And so it was definitely a sigh of relief.
Bill.
Thanks, Jen. Thank you. Well, thank you everyone for coming this morning. And our industry shared my view, and that was one of shock, and only from an economic standpoint. The law, I don't think people realize the magnitude of the cost that it will impose upon all of us, and we'll soon find out. Now, people are not aware of some of the underwriting provisions and the minimum benefit levels that the law imposes. And unfortunately, in the insurance world, if you fix the benefit level and you fix the amount that you can charge, the only thing that there is flexibility in is the quality of the care. So we would have, as an industry, we would have liked to have seen something that took that into account so that the quality of all of our care doesn't suffer. As far as the employers are concerned and our clientele, we are trying to move them as quickly as possible to a defined contribution model so that employees are engaged, they become active participants in their choice of care and in their choice of financial protection when it comes to insurance products. So we're hopeful that at least that market solution doesn't rely on the law, that it can still be implemented and bring some free market pressure to the industry as a whole so that the quality of care isn't diminished in the United States.
And Bill, just real quick before we move on to Thomas, can you just explain what a defined contribution model is and what that would look like?
Sure. Most people are probably familiar with 401ks, and that is a defined contribution model in the pension world. In the health insurance world, it would be a set amount of funds that an employer would put aside, a reserve for an employee or anyone, and they would actually use those funds to go out into the marketplace and make their own decisions.
Okay, great. Thanks.
So giving me a microphone makes me want to sing. Are you ready, Tim? Let's
Yes.
sing.
No duets.
No duets. We've been working on a musical number, but I think it's a little rough, so we'll avoid it now. I do want to say the first thing that, as a result of this ruling, is that I lost the office pool because absolutely no one in the office thought that the law would be upheld. And not a single other person in the United States, other than Judge Roberts, thought that they would separate Medicaid and its decision to expand it or not. In that case, no one thought that would happen. So we were floored. That said, Ryan and I have done over 160 meetings across the state. And when this law was upheld, we both sighed, groaned. Because we have to return back to 160 places to tell people, well, you thought the law wasn't going to be upheld, so now let's talk about what's in the law. Because there are lots of people who thought that this law was not going to be upheld, and they had the ostrich defense. They put their head in the sand, and they said, you know what, I don't have to worry about this because it's not going to be upheld. Well, it is the law of the land, and it looks like it's going to be implemented. And we have to begin, as a country, to understand what's actually in it. Thus, over 500 people probably in this auditorium. And the interesting thing is that when Americans learn more about this law, they actually like the law or like components of the law and begin to support it. We've done 2 public opinion polls where people are asked, do you like the law? And people say, we hate it. It's a terrible law. And then you say, do you like no longer having exemptions on pre-existing conditions? Do you like subsidies? Do you like this? Do you like that? And do you know what? Republican, Independent, and Democrats say they do like many, many components of this law. So as the foundation moves forward, we're thinking about what it means to be underinsured and to be newly insured. Because for so long we have been working about raising the profile and raising the health profile of the uninsured, that now so many Americans are going to be insured. And how does this affect the delivery of care? How does this affect the efficiencies of care? And how does this affect the economy of healthcare? I mean, when you think that it's 17, almost 20% of our economy, healthcare is a major factor in each one of our lives, both from an economic perspective as well as a physical perspective. And this changes the rules. This changes the ballgame. And we have to begin thinking about different questions, not just about how do we get health insurance, but how do we get good quality, cost-effective care. Oh, sorry, you don't need this.
I think our reaction was pretty much the same. We were a little bit surprised that the Healthcare Reform Act actually did make it through the Supreme Court, but we had been advising our clients to begin preparing for that eventuality anyway. My initial reaction was, boy, now I'm going to have to read all 2,400 pages of ACTA. I don't want to do that. There are a lot of things that employers have already had to deal with under the Affordable Care Act, with eliminating lifetime benefit limits and some other changes, but there's still a lot of things that need to be done. The day after the Supreme Court ruling, we conducted, Mercer, my employer, conducted a webcast nationally. We had about 4,000 participants in that, and we also conducted a survey that 2,000 of those participants completed for us. And we asked them how many had already done some preparation for implementing the next round of provisions of the ACA. And 44% of those mostly large employers said yes, they had already done some analysis, they knew what the impact was going to be in 2013 and 14 and had a plan to deal with that. 40% said they were going to wait until the November elections before they really did anything else. So there's a lot of people out there who really still don't know fully as an employer plan sponsor what the impact is going to be. And there are a lot of things coming down the pike in 2012. What are referred to as summary of benefit and coverages need to be in place prior to open enrollment. The regulations defining how those are prepared were 85 pages long, so it's fairly complicated. There's the W-2 reporting actually in January for 2012. There's the reporting that employers need to do just announcing the availability of the exchanges in the spring of 2013. Open enrollment for the exchanges occurs in the fall of 2013, and employers are going to have lots of questions from their employees about how that's going to affect them personally. So getting up to speed and educating and advising our clients of all of that. And then there's the shared responsibility provisions for large employers, making sure that they have affordable coverage that meets some minimum benefit standards for full-time employees. And they've defined and still haven't clarified what that means, but essentially any employee who works on average 30 hours a week is considered a full-time employee. And if you don't provide benefits for them or don't provide adequate benefits, there could be some responsibility and some penalties associated with that. So there's a lot to do.